You know, we've all got that bottle of cough syrup sitting in the medicine cabinet. It's super familiar, totally common, but its main ingredient has a pretty wild secret. So let's take a closer look. Because that simple, over-the-counter bottle you grab for a cold, it has this surprisingly complex and, frankly, hidden side. So what exactly is in there? The active ingredient we're going to be talking about is called dextromethorphan, or DXM for short, and you've definitely had it before. It's the most common cough suppressant in cold and flu medicines all over the world. Now, its one and only approved medical purpose is to stop a dry, hacking cough. You know the kind, the annoying one you get with a cold that doesn't really bring anything up. It's really not meant for those productive, chesty coughs, because suppressing those can actually be harmful. Okay, so let's get into the science of how it's supposed to work, when you take it like you're supposed to. At a normal medical dose, DXM is incredibly precise. It acts as something called a sigma-1 receptor agonist. Now, all that really means is that it zeroes in on the part of your brain that controls your urge to cough and just tells it to calm down. Pretty simple and very effective. And when you use it correctly, the side effects are, well, they're pretty much what you'd expect from a cold medicine, right? You might get a little drowsy, maybe a bit dizzy or nauseous. Nothing too alarming. This is our baseline for safety. But right here, this is where our story takes a huge turn. Because with dextromethorphan, the dose doesn't just make the effect stronger, it changes the effect completely. Okay, this slide is the absolute core of what we're talking about. At a normal dose, it's a cough suppressant. Simple, but at a high dose, we're talking over 100 milligrams, its main function completely switches. It becomes an NMDA receptor antagonist, which, believe it or not, puts it in the same class of drugs as dissociatives like ketamine and PCP. The effect is no longer stopping a cough, it's hallucination and a feeling of being disconnected from your body. This dramatic change has led to this kind of user-defined system for describing the experience, often called the plateaus. So let's just walk through how these dose-dependent stages really escalate. It all starts with some mild stimulation at the first plateau, but by the second, your coordination gets messy and hallucinations can start. The third plateau is where things get really intense, with strong dissociative, out-of-body type feelings. And then at the fourth, we're talking a complete disconnect from reality and a very serious risk of respiratory depression, where your breathing can slow down or even just stop. So that journey through the plateaus is obviously really, really dangerous. But what if I told you the psychoactive effect of the DXM itself isn't even the biggest threat? And this brings us to the most critical safety warning of all. The real, life-threatening danger often lies in what else is packed into that pill or that bottle of syrup. Just think about it. To get a really high dose of DXM, someone might take a whole box of cold pills. But those pills are almost always combination medicines. High doses of acetaminophen can cause catastrophic acute liver failure. The decongestants can trigger a stroke, and the antihistamines can lead to severe toxicity. This is so often the most lethal part of a DXM overdose. And there's one more major hidden danger we have to talk about. This one is all about a dangerous reaction caused by mixing drugs. It's called serotonin syndrome. See, DXM boosts serotonin levels in your brain. Now, if you combine it with other drugs that also do that, like very common antidepressants, the system can just get flooded. This overload can lead to severe symptoms like a dangerously high fever and muscle rigidity, and yes, it can be fatal. And mixing it with things like alcohol or opioids is also extremely dangerous, as it can seriously amplify that respiratory depression we talked about. Okay, so after all of that heavy, serious stuff, here's a fascinating twist. This powerful chemical actually has another, very different medical use that has absolutely nothing to do with coughing. It's used to treat a condition called pseudobulbar affect, or PBA. There's a prescription drug called Nuedexta, and what it does is combine a low, very controlled dose of DXM with another drug called quinidine. The quinidine basically slows down how the body breaks down the DXM, letting it work on brain pathways that control our emotional expression. It's just another stark reminder of how potent and complex this substance really is. So what does this all boil down to? We've seen two completely different drugs really hiding in the very same molecule. One is a helpful tool, the other a seriously dangerous substance. You know, this quote really just says it all perfectly. When you use it as directed, DXM is safe and it does its job well. But its totally different properties at high doses, combined with how easy it is to get and all those hidden dangers from the other ingredients, well, it creates a perfect storm of risk. So the next time you reach for that cough syrup, you'll know the whole story. It's a simple medicine on the surface, but a powerful and incredibly complex chemical underneath. Now you know both sides. Will you look at that bottle the same way again?